Today we're talking about a condition called stenosis. Basically, stenosis means narrowing. When we speak of it, it's pertaining to the spine. So in the neck or cervical region, you can have cervical stenosis. In the lower back is called lumbar stenosis, which is probably most common. And the term just stenosis is often thrown out there related to the lower back. What that means is the canal, the spinal canal, is actually somewhat narrowed down. It typically affects people when they're walking. So if you find patients, they'll say, you know, boy, it really hurts when I walk, or my legs start to get heavy. I start to get pain in through my hips. My hips just feel like they seize up, and then I sit down, I rest for a couple minutes, and then I'm able to get back up and carry on. That's a symptom of stenosis. Now, the surgical way to treat that in the spine is, again, the statistics-wise, is not overly favorable. We do get a good response. Again, it's not something that is completely fixed, but we are able to manage it really well with chiropractic. And specifically the Cox flexion distraction technique, because it flexes and opens that spinal canal, and it's actually, again, scientifically shown through measurements, which it's just this biomechanical studies on the Cox technique are just unbelievable to show that the spinal canal size actually widens and opens during that procedure. So we're creating those effects, but if you combine that with spinal stabilization corrective exercise, right, and you put the patient on some nutrition to help anti-inflammatory support through supplementation, not through drugs, also manage their weight, get their weight level down, these people do really well, and they're able to live more active lives and not have to undergo surgery.
Right. Congestion is really the biggest factor, right? Yeah. So congestion, not only around the nerve root, but around the spinal cord. That's why the Cox technique is so awesome, and actually that pumping mechanism is what helps to restore the congested area. Yeah. And so you get the fluid, you get blood flow, you get lymphatic drainage, all of that creates a tremendous relief factor for those particular individuals.
Yeah, and to your point again, moving fluids up and down the spine, just to add to that, in the spinal canal itself, the spinal cord's floating in what we call cerebral spinal fluid. And as we do this pumping technique, it actually moves the spinal fluid up and around, which has to go up even to the brain. So it's very interesting. You've heard people that have had like a epidural before, and then they end up with these headaches following, massive headaches following that. And it's because of the spinal fluid. So it's, again, we see patients with stenosis here at the clinic, whether it be cervical or lumbar. And if you're having any of those symptoms, we'd be glad to help you out.
And I got a fun fact here too. So, Pain Practice 2013. So one of the things to note here is you have something called failed back surgery syndrome. The AKA for that is post-surgical continued pain. And so speaking of foraminal and spinal stenosis, failed back surgery syndrome is seen in 10 to 40% of patients who undergo open back surgery. Now these numbers are increasing, and it is characterized by intractable pain and varying degrees of loss of function following spine surgery. So there's a bunch of different causes for that, but at the top of that list at 29% is foraminal and spinal stenosis. So that actually comes from a journal that was done in 2013, Interventional Pain Management for Failed Back Surgery Syndrome.
Yeah, so that intractable pain that you're speaking of, intractable pain, what that means is just unrelenting. It won't, right. Nothing's really interrupting that pain pattern. It's just, which is terrible. It's a terrible way to live. And again, what we can do is we can enhance people's quality of life through care.